Good morning, everyone. Welcome to the Enigma series of workshop. Today we have a special workshop, and it is going to be helpful for all the doctors how to grow your naturopathy practice. And even we have a lot of students joining with us, so they will get a broader idea once they come out of their student phase and start practicing how actually they can start practicing. And today we are privileged to have one of the most eminent speakers, Dr. Marutharaj, who happens to be very senior naturopath. He is a qualified BNYS from SDM College of Naturopathy and Yogic Science. He has also completed his MSc in psychology and MSc in psychotherapy. He's very good at administration. He's very good at counseling the patients. And most importantly, he is a gem of person, very humble, very down to earth. He is very successful in whatever he has done in his life, but still you can see he's so humble. And please mute your mic so there's no disturbance. Fine. So Dr. Marutharaj, he is one of the guiding force for all the naturopathy doctors. Presently, he is medical director, Sri Shivalaya Holistic Natural Healing Hospital. He is also advisor to Kaveri Nature Cure Center, Erode. He is professor, Department of Medicine in Erode, as well as he is expert consultant and trainer to the consulting company Coimbatore, and he is also director of Adi Chudi School for Dyslexia Erode. Most importantly, his channel Adi Chudi is very famous. It has more than 138K followers and more than 2.5K videos into it. So he is very accurate, precise in the way he speaks in on any topic. But today's topic is a need of hour for all of us, how to grow your naturopathy practice. So without wasting much of the time, I directly hand over the session to our most respectable Dr. Marutharaj sir. And from here after, he'll take for the session. Welcome, sir. You can start with the session.
Thank you, Vivek, and good morning to all. Vivek, first of all, I am thankful to you for giving an opportunity to be present in this forum, and also to all the office bearers of Enigma. And very happy, and more than that, uh, it is giving back to the community, that is our system. So it is always what we are all in depth to our system. What we are today is because of naturopathy. So and everyone has the responsibility to give back something to the system which help to grow. Not that what you give will help you to grow the system, but shape the system and helping youngsters, peers uh, to do successful practice across India, across globe, everywhere. So good morning to everyone and who are all present in this forum currently. Hope this next 1 hour session will not be boring for you. I know only little things and all this period of life I have learned only small, whatever, minuscules. Those things I'm sharing with you. I think there are many great eminent speakers had given wonderful presentation before in the previous sessions of Enigma webinars. I don't know whether I can live up to that expectation, but I will say what I am doing. And this may be helpful to some people and may not be, but whatever I do, and you can take this and you can improvise and you can improve, always make a change and make it as yours. So today I am going to talk about how to that is successfully take naturopathy practice into day-to-day life. Either a graduate who comes out of a college, completing his internship and getting into clinical practice, or any currently practicing doctors. So the thing is that what I believe, if you do anything in a proper, meticulous way, you need not to worry at all. You don't need marketing. You don't need anything. Your work will bring patients to you, people to you. So the quality work is very, very important. See, believe two things that whenever a person comes to you or enter into a chamber, that is the greatest opportunity. Someone is trusting you and your system and coming into your chamber for a consultation and treatment. So you should be very honest that you should not waste their resource and as well as time. See, they are going to spend some money on you, and also they are going to spend some time uh, to improve their health. So the person can always, if they lose some money because of consulting, getting treated, if they're not benefited, always they can earn back that money. But you cannot give back their quality time which they are dedicated to for their health and they have visited your clinic. So that is very, very important. So for that, what is very, very important? Two, like a bullock cart, you need two wheels to drive the bullock cart. One wheel is how strong you are in your clinical evaluation of a patient, or how strong your clinical skills. Another side is how strong your therapeutic model. If these two things are strong or at least optimized, you can do wonders. So the first thing is that whenever I till date I practice this. So what I do, that only I'm sharing with you. Uh, First thing is that whenever you see a patient, everything looks puzzled. The first day when you go into a hospital, first time you open a clinic and entering into a clinic and sitting in front of a patient and you're going to evaluate a patient, you're going to get a lot of questions here and there, and somehow you will be managing the patient. But how to refine this process and to become a successful clinician, a simple formula what I practice till date is that, see, whenever I see a patient, I take history, I do a proper clinical examination, then I do, if necessary, I do an investigation and come to a diagnosis. Then I prescribe a treatment. Then I see that whether the treatment is effective to the patient and evaluate. So what I do that day after seeing that patient, I go back to my home. I take the two Bibles are there. One is Hutchinson Clinical Manual, and another one is a textbook of medicine, Davidson or Harrison. So, for example, if I have seen a patient with diabetes and systemic hypertension, so I go and read diabetes, I go and read systemic hypertension, then I take Hutchinson Clinical Manual, then I read how to take history once again for these patients. In case of diabetes patient, what should be the questions we're supposed to ask? What should be the questions you are supposed to ask for a patient with a systemic hypertension? Then after reading that, usually history taking will be a format that we are going to discuss, a simple format. But every patient, the history taking as a tweak and a fine tuning and a novel approach. So once I complete how to take an history, then I go and read yes, proper general physical examination that how, what should have been I have noted, what should have noticed in the patient suffering from a diabetes or a systemic hypertension, what are the general physical examination I should have done. Then after that, I read again all the systemic examination, that is respiratory system or CVS or whatever may be. Then after that, the next day, then I will check the investigation what I have prescribed. The next day, the same patient comes and I look him and I look the case sheet and I compare whether I have up to the mark, whether I have done at least near possible to achieve the perfection. See, most of the time you will be surprised to see that your history taking, your examination, your diagnosis, everything will be totally different what the textbook and manual are said. And your understanding about the patient will be very poor. There's a big gap between you and the patient. The moment you have a big gap between you and your patient, then you cannot become a successful clinician because once there is a big gap, because you are not understand the patient health properly, then you are going to deliver a substandard therapeutic model to him or substandard therapeutic regime to him. So naturally, you will not get improvement. And eventually, after some time, he will go out. He will not talk about you, that is, Dr. Marutharaj is bad, he's not capable, he's not skillful, no use of going to him. Only Marutharaj only losing the thing. No, actually, you not only talk about Marutharaj, but you will talk about the system of medicine naturopathy. You will say naturopathy is useless. I went to a naturopathy doctor. His name is some Marutharaj or Varadaraj, some Tom, Dick, and Harry, but naturopathy is useless. The doctor cannot understand my problem and he don't know what to do with me. And he had given some prescription and some treatment, but nothing helped me. 7 days I went to him. I spent 7 days and I have spent money on that. And ultimately, my problem is also not gone. And again, I am standing in front of other doctor. So two things is killed here. One, a physician life is killed and a system of medicine is killed. So you have to understand it is very, very important to develop yourself and as well as the system. So what I have to do then, that is the case. That is the case. Whenever you see a patient, you understand the problem. Go back to every day, go back half an hour. It doesn't need more than half an hour if you have this practice. 15 minutes. If you refresh this, you'll be a top clinician. You are at par with any system of medicine practitioners. That means your approach will be wonderful. Still, I am saying that your treatment modality will be absolutely naturopathy, nothing else. Say, honestly speaking, all these 23 years of practice never prescribed a single pill to any patient, never prescribed even a herbal product to any patient, never prescribed any proprietary Ayurveda medicine to anyone, never ever given any supplement to any patient. I strongly believe naturopathy can do wonders. So that is the case. So what I do after understanding the patient, I'll go and read everything and apply again, and I will see there is a gap, and again I'll repeat this process until I feel that the gap between me and my patient is reduced. The gap between understanding his clinical problem and therapeutic model is reduced, so that bang on the treatment is precise. Something like a SAM missile. SAM missile, if it is fixed the target, it will go and hit the target. That's how we have to approach the patient. So why history taking is very, very important. So history taking, the basic things, you all know that name, age, sex, occupation, address, everything. But some of us not even, and not understanding why the history taking process that much important. See, by name, you develop the therapeutic alliance. You call Mr. Vivek, how are you? So you're personally getting connected with Vivek. So, and his age, there are certain type of diseases common at a certain age group. And if you take the sex, there is a certain type of disease is predominant in certain age. For example, hypothyroidism is very common in females. Autoimmune disease like SLE is very common in female. So a lung cancer or a bronchitis or maybe common among in male who is a smoker. So every single data collected in a case history is very, very important, including the occupation, occupational hazard, the place from where he comes. Okay. So if he's come from a different locality, different social, economic status, all those things gives an wonderful insight. The next thing, presenting complaints is once again, you have to listen to the patient patiently. See, most of us, we don't allow the patient to talk. See, believe it or not, if you allow a patient to talk properly, within 5 minutes, the history taking process will be over. But we interrupt. We don't allow the patient to talk. We think it's a waste of time. And don't do that. Patiently listen to the patient. And you have to understand, after leaving the medical school, the best school to learn again and to become a better doctor is nothing but your patient. Your patient is your best medical school. They are your teacher. They teach you. See, every single time, a simple statement from a patient will make you to understand that he has some specific problem that has to be addressed. Okay. So listen to the patient. Then once again, all these things I have learned in the medical school or naturopathy or medical college. See, once again, if you don't forget to ask the past history, specifically 4 conditions you should not miss, whether they have any systemic illness like diabetes, systemic hypertension, COPDs, coronary artery disease, all these 4 things has to be asked. If you are not taking a history of all these 4, then you are going to be in great trouble. For example, if you miss a patient with a diabetes and is an insulin dependent, and if you have missed taking that history and you're going to put him into fasting, the same day, within a couple of days, he'll be going for diabetic ketoacidosis, and ultimately is going to end up in a allopathy hospital. And that allopathy hospital physician going to say, where you went? You went to some person who doesn't know your health and simply say, finally, you have come to me and you are in a life-threatening situation. Then see, you are killed, your system is killed. So make sure that you take a proper past history. Then next thing is your surgical list. You have to ask about the surgical history because you are going to teach them yoga, you are going to teach them certain exercises, and also you are going to prescribe some mud therapy, plant and leaf bath, massages, everything. So you should know, is there any past history of surgery within, yeah, within few weeks, within a month, or at least within a decade, because that gives the greatest insight. Because that certain conditions, certain therapies should not be given. So surgical history is very, very important. Then, very importantly, understanding the family history, because most of the disease runs in the family. Okay, so any history of diabetes, hypertension, coronary artery disease, CVA incident in the family, if you miss, then it's a problem. And today's scenario, history of any cancer, because naturopathy is one of the wonderful preventive medicine. You can help your patient to prevent any future incidents of cancer, if at least for him. His mother would have suffered from breast cancer. The patient possibility of having a breast cancer in the future. So lifestyle change or some changes through naturopathy will prevent at least the incidence of cancer in the patient. So after that, you all know that the personal history, very, very important. Specifically, drinking tea, how much water, is all those things are very important, but very, very important. Bladder, bowel, appetite, and sleep. These four things should not be missed because patient 60-year-old having lack of appetite, losing weight, and a chronic smoker, maybe a bronchogenic carcinoma, or a 35-year-old female who is not having appetite, cough with my small amount of sputum and evening rise of temperature, then it may be tuberculosis. So all these things has to be taken along with the other things. What naturopathy we take, whether you're a tea drinker, all those things and all, of course you can do it. And definitely history of smoking and alcoholism. And you know how much smoking and alcoholism present causing systemic hypertension, coronary artery disease. So they are in your center for a lifestyle modification and you have to educate them. You believe it or not, in India, people with hypertension, 70% of the people, they doesn't need drug, but still they are taking drug for hypertension. The reason is that people who take alcohol at minimum of 180 ml twice a week, naturally their BP will be 20 to 40 millimeter mercury high. If they give up alcohol for 6 weeks, and if you ask them to maintain a monitor a BP chart, and after that, after 6 weeks, you will understand that the BP what is actually you'll be having some 160, 110 or 140, 100, or his BP is controlled with a tablet. But after 6 weeks of quitting alcohol, naturally his BP will come back to normalcy and even doesn't even need drugs. But we are not against drug. We should be always balanced. We should not put down any system of medicine. So whether the drug prescribed to him is essential. If he's a smoker and if he's an alcoholic and he's in obesity, then without weight reduction and without giving up alcohol, just taking drug is nothing but suppressing the illness. So naturopathy, what? We empower the patient. So if you educate them, this is the reason. If you give up alcohol for 6 weeks, give this data. That is every 100 person in the society who take tablet. If you see 70% of maybe alcoholic or who is taking alcohol, if they give up alcohol for 6 weeks, there is a high possibility that their BP can be normal. Even they can give up the tablet also. So then after all those things, then you'll be taking in case of a female patient, definitely you'll be taking the menstrual history and their gravida, para, how live children and abortion, all those things, very, very important. And you know that menstrual cycle history is very important. Two things we have scope for PCOS, perimenopausal and postmenopausal. And in this case, you have a wonderful role. And females with hysterectomy, they'll be having low estrogen level they will be losing their muscle mass, early degenerative joint disease. In this condition, naturopathy has a very good role in improving their lifestyle and strengthening their muscles, joints through nutrition, exercise, everything. Okay. So every history is not mechanically taken, but every history taking as an in-between line understanding, which will help you to understand patient in a proper way, and you can deliver the better therapeutic model from the naturopathy. Then I am a naturopathy doctor, and most of the patient who comes back come to me with a bundle of files and elsewhere diagnosed with different conditions. And why I have to do a physical examination or systemic examination? If you think like that, then that's all you've gone, because most of the patient who come, sometimes some patients diagnosis missed even by a better physician. So you believe in yourself, keep the records apart. First, listen to the patient, understand the patient, take history properly, do a proper clinical examination, physical examination, general physical examination, systemic examination, and something will leap on your face, slap on your face. This patient is having this problem, but not actually what he was diagnosed. Okay. So there are many case studies I can share with you. So, but this 1 hour is very difficult to concise and give everything. So, a general physical examination is hardly take, see, most of our doctors skip this, hardly take a general physical examination, systemic examination, hardly take 2 minutes. Make the patient to lie down, ask them to check their eye for icterus, jaundice, and pallor, and check for the lymph nodes on the neck, and check for the pulse, check for cyanosis and clubbing and edema. Most of the time, at least it will prevent you to choose the wrong patient, because sometimes you are not supposed to treat some patient. You are not supposed to touch that patient. Better send them to the right clinician. So that itself, you are saving yourself and saving naturopathy, but also you will gain very good reputation. The patient will say that I went to the doctor. I say that I have come here for naturopathy treatment, but after taking history and proper clinical examination, he said that no, you have so and so condition. This is first has to be addressed by a physician. Later, you come to me. I will work on your lifestyle. I will help you in natural medicine or naturopathy, which will fix your problem permanently in the future. So this you have to communicate. So then for that, you have to do a proper general physical examination, hardly 2 minutes. Then after that, a proper systemic examination, it also not take more than 2 minutes. See, a respiratory system, you have to auscultate bilaterally to understand whether air is entering into the lungs bilaterally. Is there any added sound like wheezing or cryptus? Then you have to see S1 and S2 is normal, there is no murmur. Then you have to check the abdomen whether it's soft, there is no organomegaly. Then you have to do a simple CNS examination to understand the higher mental function, and also to understand whether there is no focal neurological deficit. Then proper, if at all the patient is having any musculoskeletal problem, proper examination of the knee joint. You should know how to examine your back pain. You should know how to examine your neck pain, and how to examine a patient with osteoarthritis. Whether sometimes people come to you with a complaint of back pain or knee pain, and you'll be all you scan, everything will be totally normal. Spine will be normal, knee will be normal, joint space between the knees normal, no cartilage damage, everything. But still, the patient is complaining of back pain or a knee pain or a thigh pain. One simple condition which cause all those things is called as IT band stiffness. And if you correct that one, the patient will be back to normal life. Okay. But if you don't understand that, you will be treating it is a case of lumbago or lumbar spondylosis or degenerative joint disease of the knee joint, that is osteoarthritis. But after 7 days of the treatment, patients still go back with pain, and someone will identify it is not a osteoarthritis, it is not a lumbar spondylosis, it is a simple problem called IT band stiffness, that is iliotract stiffness. Okay, IT band is nothing but iliotibial tract. That band is there, not that stiffness. So this is very important. A proper systemic examination, you should not do it. You should do. You should not miss it. Then after that, make sure that you are doing a proper investigation of the patient if required. If it is an IP or OP setup, if the patient is coming to you, if the patient is having any investigation within last 3 months, accept that investigation more than enough. If it is not there, you may help him to understand that the basic investigation like complete blood count, fasting blood sugar, a postprandial, anyone after the age of 40, HbA1c, urea creat, that is urea and creatine, then you have to ask for liver function test, thyroid function test, lipid profile, a complete urine analysis. Why it is so important? See, if the CBC, you will be understanding whether the patient is anemic or not. In India, most of the women or some of the women, their HB is very poor. They say that they have hair loss, they are tired, they are fatigued, breathlessness, everything will be there. The simplest cause maybe anemia. Same way, hypothyroidism is the one of the cause for gaining weight, losing hair, and fatigability. So, a CBC simply rule out the anemia. Then fasting and postprandial and HbA1c rule out diabetes. Surprisingly, we have seen patients who had been treated by a physician outside, but they are diagnosed as a diabetes first time in our hospital. See, now also I have a patient here whose HbA1c was 13, okay, but the patient was not aware of that. Even she underwent a surgery, that time also she was not detected diabetes. The first time she was detected as a diabetes, okay. Then she's so happy. Then that is the case. If necessary, taking an opinion from a physician is nothing wrong in that. Along with your own therapeutic model, we can deliver. Then after that, liver function test. See, most of the time we say that we do detox and rejuvenation. You know the first six organs which cause detox in our body. The primary organ which does the detox in our body is liver. So if you don't do a liver function test, and how come we can say that we are going to do a detox? So you have to educate the patient and why we are doing all those tests. And once again, free lipid profile test has to be done. Why? That is understanding the triglycerides, total cholesterol, HDL, LDL, everything is very, very important. And you know, the incidence of coronary artery event and cerebrovascular event in India is very common. So you have to do a proper lipid profile analysis. And vitamin D, you know that surprisingly now in India, it is an endemic. Wherever you see patients are with less vitamin D, this causes a lot of problem. So all these investigations they are doing, but you should know how to interpret. For example, you are doing a lipid profile, and if you find a very abnormal lipid profile thing, like high triglyceride level and high LDL level, so you need not get panic. See, most of the patients, when they see that, they ask whether I have to take medication. See, there is something called as cardiovascular risk scoring is there. It is available. American Association of Cardiology Association, they have given a calculator. So if you feed all this lipid profile value along with whether their systemic hypertension is there, whether they have a history of smoking, drinking, all those things we put, then it will give you a score. Based on that, you can understand whether he needs a medication or not. So most of the time, most of the people doesn't need medication initially because you first have to take a chance. 6 weeks putting into a proper lifestyle restructuring, then surprisingly you can see most of their lipid profile will be reversing back to the normalcy. So, and once again, if there is an abnormal value in the report, like vitamin B12 deficiency or some other thing, so because today the fancy investigation also is done at many institutions, but any numbers has to be clinically correlated. For example, a patient is having B12 deficiency less than 200, but you need not to worry about he has to take a B12 supplement or nothing. Ask for, is there any tingling and is there any paresthesia? Is there any numbness? Is there any myalgia? If nothing is there, just a proper B12 diet advice is more than enough. You need not to advise the patient to take a supplement or anything. So all this investigation, right from the history taking, proper general physical examination and systemic examination, and with your investigation and integrating everything, and you will get a proper diagnosis. And if you have a proper diagnosis, then you can prescribe your therapeutic model in an effective way. So this is the basic thing. This you cannot skip. If you believe that I am a naturopathy doctor, I don't need to do this, then 50% only you are doing. Yeah, bullock cart is running with only one wheel. So eventually it cannot run for a long distance. Okay. So you may start your practice gradually, slowly, but if you want to run a long, like if you want to run like a marathon runner, if you want to become a marathon runner, then this has to be done properly. Okay, this is on the examination, history taking, examination, diagnosis, everything. And once all those is done, and repeat this model, go back, read your textbook of medicine, read your clinical examination manual, and come back and again visit the patient, recheck whether you have done properly, and refine it. Okay. Now come to the naturopathy prescription. Okay. So naturopathy doctors, unlike other system of medicine, your consultation are going to be a bit lengthy because you have to give a lot of explanation. For example, if they are going to put a patient in a naturopathy hospital, you have to educate them what is detox, what is rejuvenation, what you are going to do. Simple thing, what normally I do whenever a patient comes to me, I will say that, see, you are going to undergo a naturopathy treatment in our hospital. So this place may look like a resort or this place may look very serene, but when you are undergoing naturopathy treatment, there's a lot of things are going to happen. First 3 to 4 days, you are going to have a rough ride. Why? Primarily what we do, our treatments are drugless. We don't give any pharmacological intervention. But in case you have any serious systemic illness, you can take. So what will happen in the first few days of naturopathy treatment? First thing, what is detox? Detox is nothing but we have trillions of cells in our body, trillions and trillions of cells in our body. Like 3 times a day, we have breakfast, lunch, dinner, everything, and the next day morning we pass the fecal matter out. The same like that, each and every cells in our body releases biochemical and biological waste. These biochemical and biological waste are act as inflammatory mediators. They may affect the immunity, they may affect the hormonal system, they may affect the gut-brain axis, or it may affect the hypothalamo-pituitary-ovarian axis. So in detox, actually what happened? There are 6 organs in our body which is naturally present in our body. Doesn't mean that we have come to when you come to a naturopathic hospital, the detox is happened only here. No, nature is very, very superior. It has kept a wonderful detox system in our body. For example, we have a liver in place, we have a spleen in place, we have a lung in place, we have a skin in place, we have a kidney in place, okay, and spleen in place. So, the highest detoxing agent organization is liver. It detox most of the toxins, unwanted things in our body. Same like that, your lung detox and spleen purify the blood by killing the any pneumococcus or damaged platelets, RBCs, everything. The same way, your kidney filters and your colon throws the unwanted things and your skin. And so all these organs are already doing detox. Doesn't mean that only when you come to a naturopathy center, you will get detox. No, you have a wonderful system like this. We stimulate all the 6 organs to work optimally so that the elimination takes place wonderfully. So followed by that, next thing, when you put the patient into fasting, then something happens. The defense mechanism is triggered and autophagy starts working. What is autophagy? Autophagy is nothing but our own body will eat defective cells, any malignant cells, any pathogens present in our body and cleanse the body. Then next what happens? We work on your immunity. Your immunity doesn't mean that we are going to make your immunity superhero. No, we are going to optimize your immunity because most of the people believe that we can increase the immunity. If you are going to increase the immunity of a person, then you are going to cause autoimmune disease. So we are not supposed to talk like that. If your immunity is underperforming, we help them to optimize it to the normalcy. If your immunity is overperforming, like allergy or autoimmune disease, then we are going to tame down it to optimize to work normally. So we do an immunomodulation. The next thing, we work on your circadian rhythm. See, our body has a way of functioning in the day and the way of functioning in the night, either your hormone or chemicals, whatever it may be. Next thing, what should happen at the age of 5, what should happen at the age of 50, and what should happen at the age of 80. Everything is totally programmed in a peanut-sized nucleus present in the hypothalamus called as suprachiasmatic nuclei, which regulates the circadian rhythm on our body, which has 50,000 neurocircuitry mechanism. You believe it or not, 50,000 neurocircuitry mechanism present in the suprachiasmatic nuclei, which is present in the hypothalamus, which regulates the circadian rhythm. So we'll help you to fix your circadian rhythm. So first few days, when you are getting detox, when your immunity is modulated, when your biological rhythm is optimized, that is the fundamental thing for your health, you are not going to feel pleasant. You feel that you have come to a wrong place because there is a kind of micro tsunami happening in your body. You may puke, you may have headache, you may have loose stools, you may have eruptions, you may have bad odor, or you may have a running nose, or everything will be there. So all those things are a sign of elimination in naturopathy, what we call as healing crisis. A migraine will become worst. It becomes a nightmare. Insomnia will be flared up. So first 3 to 4 days, you will have all those things. So educate the patient. See, very, very important. If you don't educate the patient in naturopathy and is simply putting him into the treatment, the second day, third day, he's going to come and sit in front of your OP and ask for a discharge. And if you want to improve the treatment compliance, you have to educate the patient. If you don't want to talk to the patient, then better you need not to practice as a naturopathy doctor because communication is very, very essential. So after that, once you teach everything, then you have to educate what we are going to do for his health condition. If it is a back pain, what you are going to do. If it is a neck pain, what you are going to do. If it is a diabetes mellitus, then what you are going to do. And if it is a dyslipidemia, what you are going to do. Then there's a combination of everything. Then what else we are going to do. That has to be explained. And when they are undergoing treatment for all those things, then what will happen to them, what kind of changes will happen to them, that you have to explain because you should not act as a dictator. You have to understand each and every patient walking into your chamber is giving an opportunity for you to treat the patient. You are not great, your patient is great. And make sure that if you are not making your patient perfect, then you are gone. So every single day, you have to understand that is the first day of your practice. Believe that if you don't have a patient in your hospital, then you don't have any role in your hospital. And there is no need of an hospital at all. So you have to understand patient is the priority. Listen to the patient while consultation. Don't on your cell phone. Don't pick the intercom or anything unless otherwise it is an emergency. You keep a code or something like that. Your team has to contact back to you. So sometimes my friends will say that, sir, several times I called you in the day, but you didn't pick my phone because when their patient is with me, I ignore phone calls unless otherwise it is an emergency warning. That kind of system I have with me. So if that is I have to attend. So this is important. You have to explain what are the conditions he's having and why or what you are going to do and educate, and then only you'll follow the treatment properly. And without this, all those things, if you put the patient directly into treatment, and he will be totally chaotic and blindfold, and he will not follow, and he will not do that in home also. So once all these things are done properly, properly history taking and properly educating before what happens to the healing crisis, then explaining about the condition and giving a proper treatment. And once this is done, make sure that the patient has to do all those things at his home. Okay. See, in the initial period 2003, I have started my practice. Okay. The time I was practicing in a very, very small town called Erode. And I had one great advantage. Dr. Dwarak presented this forum. He was practicing in Erode. Much earlier, I have come to Erode. So that is only visiting card I was having. So I used to say there was a Dr. Dwarak and Dr. Saraswati who are practiced in Nalaswami Hospital. So that system of medicine I am going to practice here. Otherwise, no one knows anything about naturopathy. Yoga is known everywhere. And you believe it or not, in Europe, yoga is very strong. We have Isa Yoga, we have Valgavalamudan, we have Pandit Ravind Shankar Ji, everything. And if I say that I'm a naturopathy doctor and I'm a yoga doctor, then already we know yoga. We are practicing in Isa, we are practicing in this one, Valgavalamudan, like this and all. And naturopathy, they don't know what is naturopathy. They think naturopathy is physiotherapy. So most of they call this a physiotherapy doctor. And or sometimes doctor, Siddha doctor, they'll call Ayurveda doctor, but they don't know what is naturopathy. So in those days, each and every patient who comes to me, I was starting my practice, I started a OP practice in an allopathy hospital as an naturopathy wing. And I designed the program, whatever I have discussed with you so far. Based on that, I developed my practice from scratch to a meaningful practice. Okay, not even a single advertisement. I never made any advertisement in a newspaper. Okay, At least I have went and spoken certain forum, not about me and not about my practice. When they call for a forum like Rotary or Lions Club to educate them about the lifestyle, that for that only I went, but not for develop my practice. But what I believe, whenever a patient walk into my chamber, he will bring 10 patients for me. Because if you treat a patient successfully, he will bring at least one person. But if you don't treat a patient successfully, he will take away 4 patients away from you. So this model only I adopted. I have selected only a group of illness. I didn't claim that I am a doctor. I can give complete cure for all conditions. There is a panacea is there for me. I have answer for everything. No, no. I limited to myself because the thing is that we should always select the commonest problem where naturopathy has the best results. For example, we can help patients with diabetes. You can help patients with obesity. You can help patients with systemic hypertension, coronary artery disease, migraine, neck pain, lumbago, even disc lesion without any neurological or muscular weakness, neurological deficit or muscular weakness, osteoarthritis. Okay, then IBS, acid peptic disorder. Okay, periarthritis of shoulder. So there are some 10 to 15 conditions are there, and believe it or not, the volume of patient for these conditions is very high. You take diabetes in a population, how much diabetes are there? How much obesity is there? How much systemic hypertension is there? High volume. And the possibility of getting patient is very easy from this group. Instead of that, you claim that I am a doctor, will cure some Rocky Mountain fever or some Peckett's disease or few disease, which few poems disease. These diseases will at least once in a lifetime we may come across or we may not come across at all. So don't take the rarest of the rarest disease, say that I'm going to cure, I'm going to treat this condition. No. Take the commonest problem where naturopathy really has a scope. Those conditions you are. But with absolute sincerity, see, one thing I have to understand, service is the primary, money is the byproduct of the service. The first 10 years of my practice, I never bothered about what is my income. I never worried about that I didn't have an house, I didn't have a car, nothing. I didn't worried at all. Only simple thing. Every single day, I invest my time in educating myself, involving with my patient, practice honestly and sincerely. I never see my patient is a money vending machine. No, they are here for getting treated for their condition. I have to treat them properly. Naturally, money will come. So first 10 years, I never worried about my income. Next 10 years, naturopathy never made me to worry about money. Okay. So if you are not going to be a successful practitioner in naturopathy and you cannot thrive with naturopathy, I am sorry, then you are doing something else. With naturopathy, you can thrive, you can do well, you can be very, very successful. I won't say that this much money you will get, this much things you will get. No, I don't know anything about that. But I am happy. I am leading a very, very comfortable life, honest life. And at least even if I don't have a good name in the society as a good naturopathy doctor, at least I don't want to get a bad name that this is a worst naturopathy doctor. He's a money monger. He will always think about the money. So never see your patient as a customer. Always make sure that if a patient comes to you with a health problem, for example, periarthritis of shoulder, primarily maybe caused to diabetes mellitus, make him to fix his diabetes, then work on his periarthritis of shoulder, and you make him to understand that, sir, you should not come back to me again with the same problem because you are not my customer or client. I want you to get empowered. You are always welcome to my chamber to greet each other and let us talk something and go back. But I don't want to come you back as a patient. Even if you come back as a patient, I'm going to treat you, but I don't have anything new. Every single time come, I will ask you for a lifestyle changes, diet regulation, simple naturopathic measure, a proper exercise for the frozen shoulder. You have to quit your smoking and alcoholism, cut down your sugar intake, all those things. The same thing only I'm going to say. So why you have to come again and again to me? If you follow this, you do good. This is what I say to my obesity patient also. So obesity, the weight loss should be in the hand of a patient, not in the hand of a dietitian, not in the hand of a naturopathy doctor or fitness consultant. We should empower the patient. They should know how to take care of their health. They should stand on their own leg. And in fact, those people has to take this message and they have to educate their family member and society, make this society a healthy, empowered society. So you are contributing to the society also, nation also. So if you want to take naturopathy in a successful way, I think this all these things has to be done. And very, very important thing, most of us don't trust in, sorry for generalizing most of us, some of us or some maybe, uh, we don't believe in our own therapeutic modality. See, we have a wonderful therapeutic modality like yoga. How many of us practice yoga? How many of us apply therapeutic yoga? You see, Westerns comes to India, they learn yoga, and just for a certificate called Yoga Alliance certification, they come here, they spend 200 hours of yoga learning, and they are dedicated. And we practice acupuncture, but unfortunately in the society, there are people who have completed just 10th standard, 12th standard, BSc, they are practicing acupuncture. You know the number of acupuncture patient comes to their acupuncture clinic, minimum of 20 to 100. And how much they charge, 700 to 1000 rupees. There is a person in Erode, I know that he sees 300 patients per day. You put only one single needle and he'll charge 200 rupees. Okay. So I am not envy on him, but I'm saying this how acupuncture is practiced outside. But we say that we are naturopathy doctor. We learned acupuncture in a very, very scientific way. We study acupuncture for 1 year. We know anatomy, we know physiology. But how many of us is applying acupuncture in everyday life? Next thing, reflexology. There are many, many reflexology, small setups are coming up in every town. And those people, not even doctor, they say that they are all reflexologists or manipulative practitioners. And what they claim, reflexology detox. And you believe it or not, it is true. If you do a proper reflexology, the patient will get proper detox. So how many of us practice reflexology in our clinic? Because we think it is a time wasting. It has a lot of energy we have to put. And we feel we are not confident in saying to the patient. But with reflexology alone, we can do wonders. Then massage. Okay. Then how many of us practice proper therapeutic massage? Full body massage is okay. But when there is a periodontitis of shoulder, you should know how to give a transverse friction. In case of a iliotibial tract tension, then how to do a release for that. So applying a therapeutic massage technique by yourself. You may have a therapist, but then and there you have to visit into your therapy room. You have to participate. You have to give a personal touch to your patient. If you don't give a personal touch, you say that I am a doctor who will sit in my chair, I will see patient and I will walk away. No, then it's not going to work. See, practically speaking, a naturopathy doctor is someone like something like I given analogy or given example is like a surgeon. See, a surgeon, what he will do? He will do consultation, and also he is the person who will go and do the surgery. Same way, a naturopathy doctor should take history, everything fine, educating the patient, everything, but he should involve in the treatment. I do proper consultation, I'll do proper treatment, prescription, everything, but I don't go for the yoga class in the morning. I don't go for the therapy session when the patient is taking a back hair massage. There is a back pain or there's a periarthritis of shoulder. I don't go and involve and I don't give a personal touch to the patient. Then absolutely your therapist will not be knowing that. Your therapist is good in executing the technique, but he doesn't have the knowledge what you have. Where is the exactly the tendinitis or aggressive capsulitis? Where is the inflammation comes, origins and ends? Okay. So if you go in between and give your personal touch and come back, the quality of treatment will go up and your patient will be much more connected to you and you can give results. The same way, and the amount of yoga what we teach to the patient, we do it very, very mechanically. Or some of you may be practicing very effectively. I don't want to generalize. I'm sorry if I'm talking in that way. See, most of our system of medicine is mindful practice. And if yoga is not in your mind, it is not taught to the patient in a mindful way, then there is no use in that. See, most of the time, patient comes to us, we need not teach acrobatic yoga, we need not to teach a gymnastic type of yoga, but a simple yoga, how to practice. Okay? How to, the three things, make the patient to do yoga in a comfort, Stiram Sugamasana. Okay. making him to understand that you should achieve some comfort in yoga. Then achieving a effortlessness. That is Prayatana Saitalyam Ananta Samabhaditam. So that is your effort should become effortless. Next one is Dadodanta Anabhigataka. That is pair of duality. That is how to overcome stress. Here, the last thing you need not to do about the pair of duality or anything. At least when they practice yoga, why they are practicing. In case of a diabetic patient, he should feel that whenever he practice yoga, his pancreas is strengthened in each inhalation, and whenever each exhalation, all the weakness and negative emotion and negative energy goes out of his pancreas. So a mindful way of teaching the yoga is very, very important. How many of us people are teaching meditation to the patient, relaxation technique, which is very, very essential. The same way, our therapeutic modality has to be applied in the strongest way. But unfortunately, you can see some people outside, they are not doctors, but they strongly believe naturopathy. They strongly believe massage. They strongly believe yoga. They strongly believe acupuncture. And they are doing much better than that of a naturopathy doctor. And see, Tamil Nadu alone going to produce 1,500 naturopathy doctor, if I'm correct, 1,500 naturopathy doctor every year. And take all India, maybe 2 to 3,000 doctors will be coming out. Where is the job opportunity? How we are going to do? How many hospitals are there going to observe as a doctor? So, if want to thrive with naturopathy, I don't want to say survive, thrive. Mitesh used to say it is thriving is very, very important. Then if you have just a 10 into 10 room, one simple room for massage, a simple place for yoga, you can do wonderful. There is a guy called Chandras Kumar in Varkala. He teaches skills. He teaches yoga. He teaches reflexology. He teaches shiatsu massage. He teaches Thai yoga massage. So skill is equally important. You may be a better clinician. If you lack skills, then you are gone. So invest your time in learning the skills. After coming out of BNS college, 5.5 years, and you should give more time in learning your clinical subject, everything fantastic. The same way, your therapeutic modality, that other wheel of the cart, that is yoga, your diet prescription, your acupuncture, your reflexology, your mud therapy, everything has to be learned. You should know how to apply with the topmost precision standardization. See, most of the centers, what they do, they simply give treatments, but there is no standardization. So again, I'm sorry that most of the centers I'm saying, so maybe many people are maybe doing proper. I should not take it generalized. I should not make a generalized statement. See, it has to be standardized. You cannot believe that what you are giving in yesterday is correct today. Every single day you have to update your treatment. If you take allopathy, each and every therapeutic modalities are changing. For example, those days, open heart surgery, they open the entire sternum and they do a CVABG. Today, they reached a state called keyhole surgery. Then later they did that through interventional cardiology. You doesn't need CABG. Just a stenting can be helpful. Laparoscopy earlier for appendix, they make 1 kilometer incision. Today, 1 inch incision, not even 1 inch. And same way, spine surgery, they are doing with endoscopy. How come it is possible? They always look for an improvement every single day. Their approach is refined. How this can be done in a better way every single day. If we are not going to do in naturopathy, then we cannot progress. See, it is not the progress of you. It is not the progress of we. It is the progress of the naturopathy. If this system is not growing, then we are not going to grow. And every person who completed BNYS and practicing today, we are responsible for the younger generation who have joined naturopathy colleges, believing that they can successfully they can become a naturopathy physician. If you want to make them to be successful, and we have to do all those things, and if you don't set an example, then they cannot follow you. So uh, my kind request is that whatever I spoke to you, I never felt that uh, sharing all the secrets to the people here. No, nothing. I give everything to me. I give everything what I have. I don't hide anything. Whatever the materials, books, diet chart, everything. Who want all ask, I'll give everything to people. I never believe that hiding a comb can stop a marriage. No, we have to give. The more you give, more you will get, and you have to understand that we have to strengthen our system by sharing our expertise. Because I don't want to say that generalize, but people believe that or have an insecurity that if we're sharing our technique, secrets, method, then we lose our practice, we lose our scope. No, there, see, if you are having an hospital, it is a 50-bed hospital. In a district, I'm saying, for example, if I take, I'm working in Erode, a place called Kangayam, I still strongly believe that 50 naturopathy hospital with the bed capacity of 50 to 100 patients can do wonderful in a small district like this. So we have 140 crore people living in India. And if you calculate 1%, for example, 14 lakhs. To treat 14 lakh patients, how many naturopathy doctors are there? No. If you get at least 1% of the population, they come for naturopathy treatment, we cannot treat. Only limited doctors are there. So, if you want to take naturopathy to the next level, you have to do all those things. This is my idea. This is my understanding. This is what I am doing. I may be wrong. I may be crude. I'm always open for correction and willing to learn. Till now, I am learning from every people, from my juniors, my seniors, even from the college students. So I'm going to conclude now. So I'll be sharing this clinical workflow professional development protocol to you, and also a small clinical manual developed by our team of doctors that also I'll share it to Vivek to his WhatsApp number, and I think he can share with the people who all participated in this group, or even people are going to see the recorded session. So I am sorry if any point of the time I am bit any arrogant or talk in a overconfident way. No, just I want to express my anguishness certain places. So I strongly believe that life will humble us. If at the moment we believe that we have grown, we have done wonderful thing, then immediately life will make us humble. So uh, I have know only few little things I have shared with you. There are many, many great things are there with you also. I can learn from you. There are many speakers that have spoken in the past. Maybe they are going to speak in the future also. So every single day we have to learn from people, and one single cause, we have to take our system to the next level. Please be open, be generous, share your skills, share your knowledge, and definitely you can also equally grow. And last thing, be honest and sincere to your system, and also very, very sincere and honest to your patient also. Never see the financial aspect, because the moment you as a doctor see the financial aspect, then you are doomed. At least I'm saying the clinical space. Money will come. It's a byproduct of your clinical practice. Okay, but don't practice for the sake of money. Okay. So with this note, I'm ending. If is there any question, I can answer. Vivek, if I have crossed the limitation of the time what I had given, I'm sorry.
Rajbhai, it's absolutely fine, and there's no time limitation as such when we have this workshop. Um, you can always say, because people are learning from you. I think the knowledge what you're sharing is something cannot be given in books, and the way you are presenting it to them is really wonderful. So I would like to take up questions, and
Sure.
I would request Dr.
Thanks.
Dwarkanath Anna to share his views after this session.
Guys, you can ask me any questions. Whatever the little experience, little knowledge what I have, I will share with you. If at all I know, if I don't know, I'll refer and tell you.
Okay, we have a question, Rajbhai. We have how to increase footfall to our clinic.
Yeah, this is what I said. My model is that I need only one patient has to walk into my chamber. Do this thing properly. Sincerely, do the routines what I have said. Proper history taking to examination, and properly prescribing the treatment protocol, and properly educating the patient and making the patient to involve and educating him to at least follow one third of what our recommendations, and do a simple follow up with the patient. If that patient bring changes in his health, and he will bring people to you. This is what I believe. But today, in this era, the other thing what I did during this COVID time, I started a YouTube channel uh, or a social media presence. That thing when I started, it is not that to build my practice or make to so that or it's not for a business model. It is a completely health model, creating awareness among the society. Talking more about the health, not about the disease, not instilling the fear, but instilling the confidence, how people can take care of their health, how they can overcome their ignorance. Okay. You believe it or not, in Facebook, I have almost 1 million followers. And of course, in YouTube, 1,30,000. And in Instagram, almost 50K, 56K people are there. In none of this YouTube channel platform, I have not given my private cell number or where I practice. Most of the people they don't know, because what I believe that uh, patient has to be grown organically and not through marketing. But this world is totally different, and everyone need not to be like me. So social media platform is wonderful place to grow your practice. If you are genuine in communicating what you are doing, and genuine in educating the population, genuine in empowering the individual in the society, so naturally you can increase the footfall to your clinic. And make sure that your core therapeutic model has to be applied strongly. For that, you have to apply first on you. You have to practice yoga properly, and you should understand acupuncture properly. You have to attend workshop, practical workshop, learn from people, and do a proper acupuncture, reflexology, massage, weight reduction exercise, or whatever it may be. But you have to believe in your core therapeutic model, and you have to apply on you, and you have to educate the people. And also you should have a proper scientific diet advisory protocol for each conditions. Okay, and it should be based on a scientific line. Okay, and it should be very, very practical. You cannot prescribe a drug, food item which is not available in India. If you're advising something, you have to cross seven seas and seven mountains. After that only you will get this thing, and then only you will become all right. No one is going to follow. Even the commonest food item, they are not going to follow properly. So give you a simple diet advice which is very practical, applicable in day-to-day life. All those things definitely. Patience is important. You cannot grow overnight, but 3 months to 6 months, definitely you'll be having a decent numbers. Within a year or two, definitely you can do good.
Rajbhai, we have another question from an intern, Dr.
Yeah.
Madhu. She is asking for your suggestion. Within 3 months, she'll be completing her internship from Gandhi Naturopathy Medical College, Hyderabad. So,
Okay.
your kind suggestions for her.
Yeah, whatever I said, and I'll be sharing a clinical manual and a clinical workflow and professional development protocol to you, and that you can share who is want to come into clinical practice, or that is depends upon what kind of careers is going to take. See, there is with BNYS you can do wonders. See, you can work in wellness industry. You can work as a uh, Dr. Dwaraknath is the greatest example. He conducts retreat across the globe, and you can work in a corporate as a health consultant, and you can have yoga studios, movement medicine. You take your cousin Abhishek Agarwal. He's in Phuket. Recently, I met him. He's doing wonderful. He's having a wonderful yoga studio, and many foreigners are keep visiting him, and he makes a very good living there, and wonderfully is recognized there. And uh, you can have a model clinics where only skill kind of treatments can be executed. So there is, and you can work in a college as a teacher, and you can work in a hospital as a medical officer. You can have your own clinic. So many things are that depends upon the individual's interest.
Thank you, Rajbhai. I think that should help Dr. Madhu for her after her internship. We have a question from Dr. Muskan Dhankar. She's asking, I have recently completed naturopathy from SGT University College, Haryana, searching for job, but there are very less to practice. So, mm,
Muskan, is it Muskan, no?
Dr. Muskan, yeah.
Yeah, Dr. Muskan, don't be disheartened. I am saying that confidently. You start your own clinic. Don't worry about the job. you becoming a job provider, start a simple clinic, at least start an acupuncture practice, start yoga, something like that. Yeah, at least a simple nutritional prescription kind of thing you can do well. Naturopathy will definitely take care of you. Trust in naturopathy. Naturopathy will take care of you.
Thank
Don't
you.
worry about the job. See, I say that, see, 2 decades before, no one knows anything about naturopathy in Europe except the platform what created by Dr. Dwaraknath. Okay. So it is very bleak, but still possible to thrive on that. Okay. So now, today, this is a medicine of the future. No, medicine of the present. Say again, if we say future, then when the future will come? No, it's the medicine of the present. You have wonderful scope. You can do wonderfully, you can practice naturopathy. But only thing, you have to understand the concept. Whatever I have spoke now, I think probably it will be in the Zoom recording. You can refer that again and again. Don't take it as it is, because I may be blabbering this and that. Make something from that, take something from that, make it as yours. Make it as Muskan's. Deliver it, you will do good.
Mhm. Rajva, we have a question from fourth year student, Chetna. She is seeking information about postgraduate options and professional opportunities after BNYS.
Postgraduate opportunities, MD
Postgraduate,
is available. MD is available in many colleges.
yes.
I think in SDM they have. I think at Tamil Nadu two government college they have MD. That is one thing. And another thing, if you don't want to do MD in post graduation in naturopathy, then you do one thing. You do psychology training, but unfortunately, UGC has come a rule that from this year onwards, they are going to scrap all those online course. But still, you can do psychology in some other means and some postgraduate diploma in counseling and psychotherapy that will be helpful. And do a yoga line certification course where many, if you are going to travel outside, if you want to practice yoga or if you want to get employed, you need a yoga line certification course.
Thank you, Rajva. And next question from Bhavna Maniramanji. Good morning, sir. We'll be starting our internship soon. Our college has proposed an opportunity to do as a period of internship abroad. What is your opinion on that, sir? Can we do our internship?
Yeah, the doing internship in abroad is a wonderful opportunity, because in abroad, they are not seeing this as a naturopathy. It is more of healing and wellness. And of course, one of our senior, Dr. Balan, he has a company called H Resource, and he is organizing internship across the globe. People who want internship outside the country can contact him, and he can help you in that regard. And that will be a wonderful opportunity doing an internship outside, provided people have an inclination to work as a wellness expert and a healing expert. Because in the Western country, they don't say naturopathy, they say more of healing and wellness.
Uh, we have another question, Rajbhai. Uh, we have a student from Rajasthan, and after completing BNYS, what are the postgraduate opportunities available? As you have already explained, MD and post-graduation in psychology. He's from Rajasthan, where there are no PG options available in the state.
So
So,
what I will say, think about that. If you want to go for a teaching profession, you need all this post-graduation, all those research, everything. You need MD, everything. But after completing BNYS, make sure that you are doing skill training. So you come out, but whether your yoga is at par with the global standard. Come out and you check whether your acupuncture technique is at par with the global standard. Come out and check whether your massage technique is at par with the global standard. Come out and check whether your reflexology is at par with the global standard. Unfortunately, we have a degree of 5.5 years, but we lack skill. That's the truth.
um, say what you can do is, if you're not able to, he was trying for admission in SDM or in Tamil Nadu. Um, in Tamil Nadu, can he get seats for PG?
They have to write an exam, I think. In Tamil Nadu, they have to write an exam. Government notification will come, they have to write the examination.
Okay, so in Tamil Nadu, they can write an exam.
Yeah.
Still, if you can go, you can, if you're not getting an SDM, you can look for the other colleges in Karnataka. There are lots of colleges
Yeah, maybe.
and for
I
more,
think, yeah. Vivek, for that, what I can do, see, since on the academic side, since I'm a clinician, for this PG related thing, everything, you can create a kind of forum or hub where people can give information or collecting details and where and all post graduation is available, where and
yeah,
all skill training is available, that we can make a document or something like that you can share in the forum.
yeah. What you can do meanwhile is I am sharing your website in igma.net. You go into that, and in that you will have list of the colleges which are offering the MDs. So still, if you have confusion, you can directly connect with us. The name of website is inagma.net. That there is option to look for colleges. There you will get broader view uh, what colleges who are offering MD degree. Okay. Um, Another question. Sir, books for nutrition and dietetics. Any specific book?
I'll do one thing. I will make a list and send to you, Vivek. There is a many number of books are there. See, first thing, standard books are available in National Institute of Nutrition, Hyderabad. That is the basic thing. Okay. Then there are specialized nutrition kind of books. All those things are there, which I will send the list to you.
Perfect. We have received a appreciation, Rajbhai. Thanks to Dr. Raj for great presentation, which I am sure benefited everyone. And also, they have thanked me that Dr. Vivek doing a remarkable job organizing these sessions. Yes, we are trying to build a strong community. That's what we are trying to do from our end. So,
From
is it
whom, Vivek?
uh, actually this is from a common joining link, so they have not
Okay,
shared
okay.
here. So you can please
Okay,
share
okay.
if
Yeah,
it's
yeah.
and we have it is it necessary to get a certificate from Yoga Alliance to start practicing therapeutic yoga?
Not necessarily within India. People who want to go out, work abroad, or who want to work wellness industry in India, or wellness industry abroad, like this one, cruise, all those things, you need Yoga Alliance certification because that is only recognized. And the people like Dwarak, they don't need any certification because they are uh, above everything. Because only Yoga Alliance needs Dwarak. Dwarak doesn't need Yoga Alliance.
Rajbhai, there is another thing for you.
Yeah.
Thank you for the wonderful workshop, sir. We have a suggestion and request. We are students. We are lack of therapeutic practice and experience. So we seek your permission to visit your hospital and clinic where we can learn under your guidance. So is it,
Okay, they are from which place?
um, please mention your name of the college and place so that he'll be able to guide you. Okay. Uh,
Share my number with everyone, Vivek. See, you can share my number with everyone and they can contact me. I don't have any problem. But only
Better,
thing, I cannot.
I will write your number in chat box. So
Okay.
that's from Anand Bhai, Amara Anand Bhattu
Yeah.
sir.
Yeah. Yeah.
Um, just a second. I'll be sharing your number. Everyone, please check the chat box for Raj Bhai's number. You can connect him with him for further guidance. Okay. Um, Coming back. Thank you so much, sir. We have appreciation received. And thank you from Prishta we have received. Thank you for the wonderful session, sir. Bhavna from Bhavna Maniramanji. Dr. Muskan is thanking you for your wonderful session. And again,
Yep.
thanks to Dr. Raj for his great presentation, which has benefited everyone. And the one we have received, I am naturopathy student in Vivekananda Naturopathy College in Sankagiri Erode. please, I
Yeah.
need your contact number. So we have already shared sir's number. You can directly in the chat box. You can save the number. And we had M. Nisha from, I think, Swami Vivekananda Naturopathy Yoga Medical College. So even you can connect.
Okay.
And we have a message. Kriti Durai. Good morning, sir. I am, just a second. Good morning, sir. I am going to complete my internship and immediately can we open clinic, sir?
Why not?
Yes. You can open the clinic, learn more skills, and start doing your practice. So from Dr.
What I'll say, people who are completing the internship, before taking the first step, what they want to do, if they have an idea, they want to open a hospital, or they want to open a OPD based practice, or something like yoga center, yoga studio, or skill set kind of studio. Take a tour of that. Do a ground research, groundwork. Uh, do a survey. Visit few centers. Then come back and do your own brainstorming. Then finally you start that. Not that completing your course and next day opening a clinic is not advisable. At least 3 to 6 months we can do this kind of activity. Once if you have decided, okay, I'm going to start a yoga studio, then go and study how should be a yoga studio, how much space is required, and what kind of the material is required, how to reach people, and how should be the how I should run effectively and economically, how to manage the financial crisis, everything. Just learn about the few fundamental things, which is very, very essential. Then jump, because for me it is something like that. I have to jump out of the flight and next day only I have to learn to fly, because I came to naturopathy very at the age of 26. I came to learn study naturopathy, VNYS. At the age of 82 I passed out. Then I had only rupees 750 rupees in my packet. Then I went to my native. If 750 rupees is gone, next day I don't have money to eat my food, so I have to do something. So that is a different scenario, but I think most of the people won't have that kind of problem. So people can take liberty of 3 to 6 months doing a kind of research, at least 3 months. If you plan something, do a proper groundwork, then start.
Perfect. Thank you so much, Rajbhai, for this wonderful explanation. And we have received appreciation from Dr. Nerupama, very informative and inspiring. Thank you for the guidance, sir. Preeti Durai has asked permission so that she can visit your hospital, and because she is going to complete her internship next month. Yes, you can contact him on his number. And what you have said is absolutely true, sir. After completing BNYS, we lack in our skills. So, do you suggest any courses from any institute that we can pursue to develop our skills?
Yeah, see, depends upon if you want to learn yoga, and you can visit certain yoga schools there. See, one thing we have to remove the thing is that I am a naturopathy yoga doctor. How come I can go and learn a yoga technique from a yoga teacher? No, don't do that. Because there are many yoga practitioners, they practice yoga much superiorly than us. There are many people who is it audible, Vivek? I can't listen to you.
Yeah, it's audible, Rajbhai.
Yeah, yeah. So that is very important that we'll be learning many things, even from a non-medico, even food reflexology, acupuncture, many things. Uh, but make it scientific with your basic science, medical knowledge, all those things. So skill training available many places. It's available. I think we can create a list for that. Also, I can share with Vivek. Give me some time. Uh, Possible post graduations, and or Vivek, summarize me what are the things I have to give. Whatever I know, I can give. And meanwhile, we can also collect the resources from wherever, from our seniors, juniors, or fellow naturopathy doctors, and share with these people.
Okay, Rajbhai. From Dr. Santosh, we have received. Do you take training or lecture for BNY students? I want to learn from you from Karnataka.
I'm happy to share everything. I don't have anything, nothing to hide with me, and I can do it. But only thing, time, place, where I can do all those things. We'll think about that definitely. That's what I said. No, all of us has to give back to the naturopathy, and we have to give back to our fellow doctors, and make sure that our fellow doctors are practicing successfully and they are happily settled with the naturopathy. So I'm happy to do that. But only thing, how we are going to do, how all those things has to be thought about that. I'm happy to do that.
Thank you so much. I think we can keep connected, and I will make sure that the questions like whatever Raj sir can share with us, he'll be sharing to me, and I'll be sharing in the workshop group. So be in the group. The link to the group is already shared. So finally coming to,
Even
yes, Raj
even
bhai.
we can pool the people who are skilled in certain areas, and we can arrange workshops, conduct workshop for all these people if they are really interested. Not at least minimum 5 to 10 people also enough. We can bring those people and we can do it also. That is not a problem. We can do it, and from my side, whatever I have, I will give to you. And mostly in my YouTube channel, you will get every information about the uh, thing about the naturopathy related, how to approach the patient, how to deliver a talk, or how to talk about the health awareness related thing, or even some therapeutic modalities also is there. So free to use everything,
You
and
can set
even
up a YouTube channel for that.
share the resources, whatever the resource I have with me, I will share to you, Vivek, and you can give to the
Yeah,
people in the
I'll
forum.
share that. So coming to the final conclusion of today's session has been nothing short of extraordinary. Sir's depth of knowledge, decades of experience, and his ability to simplify the true science of naturopathy have left every one of us enriched and inspired. I really thank you, sir, for your guidance on our professional growth, patient connection, and clinical excellence, which is really going to set a benchmark for all of us. We are truly honored to have you and have learned from such a great visionary who is ready to offer everything to the community. The the knowledge you had, what you have shared to us, and you have shaped the naturopathy into modern way, as I can feel after hearing all the things. Even the naturopathy education, the way you have is mentioned about the the behavior with the patient is the greatest opportunity. Those words were really everyone is enriching words. And you have mentioned one two important thing, that clinical skill and therapeutic modality has to be improvised. That was the starting one points you had mentioned, and I think that is also going to be a standardization thing. So keep working on that. Your presence has added immense prestige to our Enigma workshop series. And those who don't know, I should now tell that Raj Bhai is my classmate, colleague, and I have learned a lot of things from him in my real life. He has been a guiding force for me too. And I believe his words will help you all. So, my heartfelt thanks to everyone who joined today's active workshop, and your commitment to learning is really appreciable. And of course, your enthusiasm motivates us to create more knowledgeable driven platforms like this. Gratitude to the entire team of the Enigma who is working together, and special gratitude to Dr. Marutharaj sir. With that, we wind up.
Vivek, yeah, before conclude, I want to say that uh, whatever today I am, first of all, my sincere thanks to all the teachers who given me an opportunity to learn naturopathy. There are great teachers. I cannot name everyone because the time will be the factor. All credit goes to the teachers and all the fellow naturopathy doctors. I learned everything from you all only, and I know only little bit. Don't carried away with whatever I am saying. You have to improve from this. And one single thing is that avoid complacency. Complacency is nothing but after growing to a state, you start believing that you have done everything, you learned everything. You will start showing resistance in doing new things. You will start showing resistance in not doing things properly. You believe that this is enough. The moment if you come to that state, your growth will go down. Avoid complacency. Be sincere to your profession. Be humble. That is very, very important. And also thankful to the people who guide us. So once again, thank you, Vivek, for giving an opportunity and for all the great teachers who made me here to stand and talk in front of all these people. And as to say that Vivek and me are close buddies, and we have coffee early morning, coffee walking to Kanyadi. That thing
No,
always cherishing Vivek. Okay, anyway, thank you all. Thank you for all the technical team who organized this presentation and all the participants who listened to me very patiently. Thank you, thank you.
thank you once again, Rajbhai, for blessing us with your insights and setting a new direction for our professional journey. With that, we close today's session. Thank you.
Thank you. Thank you. Thank you all. Thank you all.